Good afternoon. My name is Jamie Reed, and I hold a Master's of Science in Clinical Research Management from Washington University in St. Louis, Missouri. I am also a lifelong Democrat, a mom of 5 boys, 3 of whom were adopted out of the foster care system, and I'm a lesbian. I am also the public whistleblower from inside a pediatric gender center. I participated in transitioning nearly 1,500 unique patients who ranged in age from 3 to 26 over almost 5 years. I was once a true believer in pediatric gender medicine. Now I understand I participated in an industry that was based on fraud, deception, and in layman's terms, we were running a racket. Patients with significant comorbidities were treated using unethical and deceptive informed consent practices. They were never properly assessed, informed of their condition, or given a diagnosis. A diagnosis itself is the first required step for any consent to be valid and not fraudulent. These were also vulnerable patients who required specific, special safeguards. First, they were minor patients and should have been provided all of the safeguarding protections we would want for all children. Second, they had significantly presenting comorbidities, often falling within the definition of a stigmatizing complex medical disease, some even meeting the criteria for a legal medical disability. We were harming disabled children. These comorbidities include, but are not limited to, autism spectrum disorders, anxiety, depression, borderline personality disorders, eating disorders, self-harming behaviors, somatization disorders, learning disabilities, ADHD, and significant trauma histories. Third, many of the presenting patients before the social contagion cohort would eventually, if not medically treated, become homosexuals, like me. That is, they will identify as adults as gay, lesbian, or bisexual. I might hold a Master's of Science in Clinical Research. That is not a requirement to understand the basic concept of medical diagnostics. Parents and the public have been deceived into believing that these assessments are diagnostic, that they're consistent, that they're comprehensive, and that no child is ever receiving treatment without one. If the assessment met the criteria of consistent, comprehensive, and diagnostic, the diagnostic provider should be able to easily produce their assessment tools, give them to the FTC to be analyzed, and they should also be universally consistent across all of our states. This has never happened. And they have not shared any data to show what percentage of those presented are being told no, because this is not happening. I personally witnessed the consequences of prescribing these treatments without proper informed consent. One of my patients, after her radical bilateral mastectomy at 19, called begging for her breasts to be put back on. This harm has not been contained to children or minors. Another patient's intellectual function was so impaired that they could not identify to me where they lived or explained what type of identification they possessed. Multiple staff members expressed concern about their ability to consent to any medical procedure. Despite these and similar red flags with many patients, this patient even stated that they desired to have biological children, yet they were prescribed a treatment that would ultimately render them sterile for life. We as clinicians in the gender industry openly stated, quote, "It does not matter if patients even met the diagnostic criteria. We did not care. If patients even had, quote, gender dysphoria, we did not care. If a patient said they were trans, then they were trans." Parents were unaware that patients were self-diagnosing, that clinicians had completely abandoned the diagnostic process entirely. Parents who didn't agree with our lies were isolated, abandoned by our centers. We tore married parents apart, and we tore children apart from caring parents who told us no. Imagine in a different field if children went in self-declaring that they had a malignant cancer. If they went to an oncologist and that oncologist, without labs or biopsies, if that child demanded to go through chemotherapy and surgery, that the clinicians would comply. And then the clinicians would then bill our insurance for those procedures, medical visits, making money for the hospitals and themselves based on this deception. This is precisely what we were doing in the Gender Center. And then we expanded this deception into a racket. We created specific list of affirming therapists who would do exactly what we wanted. A therapist could only get on that list if they would comply. We needed a letter for insurance, so guess what we did? We wrote it. We made it fill in the blank, we pre-drafted it, and I know this because I am the one who not only created this letter, but I emailed it out to all of those same therapists for hundreds of our patients. I wish I could say to you that I became a whistleblower the first time I heard the nurse say, but Dr. Lewis, we are committing insurance fraud. Because that was said and I didn't. I wish I spoke up sooner. The final death blow to my ethical medical soul, and what finally led me to speak up, is that we significantly harmed our patients. We didn't just deceive them or their parents. I hurt children. And I said to that same Dr. Chris Lewis, Chris, we are harming patients, and he said, I know, but what do you want me to do about it? I hurt the very children I was employed to protect. St. Louis Children's Hospital mission statement is simple. St. Louis Children's Hospital will do what is right for children. We did not, and all of us must now reckon with what we have collectively done.